So I'm Dr. Heather Bartlett. I'm a board-certified family medicine doctor times 12 years. My passion is longevity. Longevity to me means not just fancy peptides, not just doing modalities that are passive. It means you are changing your cellular health, and we help you find out, if you work with us in our clinic, what are the four horsemen, as Peter Attia calls them. What's going to take you out? Is it cardiovascular disease? Is it cancer? Is it neurodegenerative? Or is it metabolic? Okay? And trying to educate our patients on the interplay between those, and if we can head it off, try to pause it, plateau it, and get things going in the right direction. Can never make guarantees because we're not God, but we definitely educate our patients. We definitely get their testing, and we definitely open their eyes. And through our aggressive lifestyle change, that's what we try to make happen for people. What's an important thing? Today we're going to talk about Zone 2 cardio, and what does that mean? So we're going to show this graph over and over again so that you can see it and understand it. This is about understanding how your body burns fat. This is about understanding how your data, and only your data, is relevant to you. Don't push it on somebody else. Don't explain it to somebody else. And if it's working for you, great. And if it's not, you need to get your own data. Let's do some Zone 2. So why Zone 2 cardio training? What does that even mean? Well, we're talking about 5 different heart rate zones that we know have different metabolic and endurance impacts. When we're talking about Zone 2, and you're hearing a lot of press about this lately, and I think it's highly warranted, finally. And I'm not going to say like I always knew this, but when you look at the research and you look at the biochemistry and you pay attention to it, and if you can test for it, then it's kind of a no-brainer. So what are we trying to do usually if somebody is Zone 2 cardio training? Most people are trying to change their body composition, or they're cross-training their mitochondria. So their mitochondria, the little organelles in your cells, it's where cellular energy is made, produced, ATP. So if you're doing Zone 2 cardio, you're probably doing it for one of those 2 reasons. Trying to increase your body's ability to burn primarily fat, not exclusively, but primarily, majority, fat. And you do that by staying in your Zone 2 heart rate. How do you determine Zone 2 heart rate for you? There's a couple different ways. The most accurate, by far, is actually doing a graded exercise test to obtain your VO2 max. Oh, I did my 1,000 meters very quickly. Too quickly. I did great with my Zone 2 though. I like doing 1,000 meters because I have dreams of training for high rocks. Let's do new workout, and I'm just gonna ride. Let's see, let's just do a single ride. Zone 2, 60 to 70% of my max. So how do you calculate your Zone 2? So first of all, this is the calculation way, which is not necessarily as accurate, but it's something to go off of. So how do you figure out your heart rate zone? So I'm gonna grab mine so you can see this so it's easy for you. This is in my Concept 2 app. I have Concept 2 machines, all right? So 220 minus your age gives you your maximum heart rate. So what we're looking at when we say 90 to 100, 80 to 90, 70 to 80, 60 to 70 of max, 50 to 60, these are each of your zones, zone 1, 2, 3, 4, 5, okay? And what that is whatever that 220 minus your age, that's how you figure out your maximum heart rate. And then you multiply it by these percentages and you figure out what those ranges are for you, okay? It's not a bad place to start, but there's a better place to start, and that's with doing a VO2 max test where you can actually see as you're physiologically, as you're breathing, so we can look at your oxygen consumption. The machine that my clinic invested in is a VO2 Master. And the reason why we invested in it, even though it's an exclusive oxygen consumption calculation on what's going on with your VO2 max, is because head to head with other machines, it is dang accurate. And it doesn't require a tube being directly attached to you so you feel like you're in a space suit while you're trying to work out. And this is what this machine looks like. Pretty easy. So again, doing a calculation of your Zone 2 is not terrible, but it's just not as good. So if you got to start someplace, let's say you got no wearable, you have no access to a VO2 max test, and you're like, I'd like to do the best guess I can, 220 minus your age will get it done. Now, here's the thing. Why is doing a VO2 max test and getting those actual numbers known for you as data that is able to be extracted from that test. Why is that important? Some people may have a lower resting heart rate. Some people may have a higher resting heart rate. Some people may be on a beta blocker, for example, and it's artificially suppressing their heart rate. When you're working out and doing your zone 2 or any type of exercise, let's say you're doing for endurance, and you're actually trying to raise your VO2 max, like you got your tests and you're trying to find out how can you make it better. Ultimately, knowing the numbers from your data is the most powerful and accurate source of knowing how you should train. So if somebody's on a beta blocker, for example, it's really hard to know, should they be working out at this range higher or lower? Should the interval be shorter or bigger? What are the exact heart rate beats per minute, the minimum and the maximum, to get the most efficient fat burn, predominant, not exclusive, that you're gonna get? So if it's all you got is to do the calculation, and then you're able to go through, and there's lots of websites that'll do this for you, but you wanna take a screenshot and look at what you multiply it by so that you know what your heart rate zones are based off that 220 minus your age is your maximum, and then multiply it by those percents. That's how you can get zone 2, your range for that specifically, okay? Better though is to do VO2 max testing. And so that's why we offer it in the clinic. We invested in the equipment, we invested in the best equipment that's the most comfortable for our clients, so we can get this precise data. Because here's the issue. If I didn't make it clear when I was doing my variable resistance training, how you do and what you do with precision matters. It matters just as much when you're doing your zone 2 cardio. So doing zone 2 cardio with the best data you got, which may be no data, versus having your specific data, is a massive upgrade in your capabilities and your eliteness of knowing how you're training effectively. So what's the deal with zone 2, real quick? Turns out in zone 2, if you're looking at a curve, so it's predominance of fat utilization with a little bit of carbohydrate utilization in zone 2. So you are getting into a higher fat burn without escaping fat burn. So you're still using fat burn if you can stay in zone 2, right? When you escape it, what happens is a certain threshold, you'll no longer utilize fat for energy, and you'll be exclusively dependent on carbohydrate utilization, all right? So let's take a look. So this is what I mean when people, I'm sorry, I steady my hand here. When I'm trying to get people to understand, you really do need to know what your dialed in exact heart rate numbers are for zone 2 if you really are trying to increase your fat utilization and maintain it. If you're not doing that and you don't know what your numbers are, your success is going to be much less likely. So let me show that to you again. It's counterintuitive. There's a lot of people in the health industry who would rather you not know and understand this and keep showing up to the gym saying you're doing zone 2, but there's no way that you're zone 2. So when I hear that gyms, for example, somehow are doing some type of strength training, here's my common thing that I'll hear. People go to a gym, yes, doc, I get a kick-ass workout, pardon my French. I really do. Like, I am drenched, I am pounded, I feel great. And then we look at their body composition month over month over month, and they keep doing the same thing. Their lab indicators from a cholesterol perspective, their morning cortisol level, maybe even their insulin may not be moving. Okay, their fasting insulin level, all right? More importantly, again, their body composition, all right? So I care about zone 2 and the potential impact even from a lipid utilization perspective, all right? So it's not just about fat burning. I'm trying to see if we can metabolically impact people by doing the right thing effectively. So when I hear somebody say that, and I say, what does that look like? And they're like, oh, well, we do chest, we do all these exercises, and we go as fast as we can, and in between, my trainer has me do some HIIT or some type of cardio in between, and then we go back and we do another round of strength training. I don't know what that person is doing, because it's not true strength training. It's really confusing the body. It's trying to switch into cardio, saying they're doing fat burning. There's no way, I just showed you, let me show you again, that person who is doing some type of cardio, and if they don't have something on their wrist watching their heart rate, and if their heart rate zones are not accurate, let's go back to here again, there is no way that person is burning any type of fat during that. Worse, if you're getting a huge cortisol bump as you're working out, doing something that's higher intensity, and going into glucose burn, carbohydrate burn exclusively, not fat burn, you're confusing even from a skeletal muscle mass recovery perspective, what the hell is going on? The workouts that work best are the ones that you keep it simple. It doesn't mean that they're ineffective. People conflate simple with easy. That's not necessarily what's going on here. Nobody, let me say this right now, nobody comes to my clinic and gets to, quote, lose weight. That is not the goal. If somebody's coming in, we're going to do a body composition test. We're going to find out what their percent body fat is, how much pounds of body fat excess they have, what is their skeletal muscle mass. We are not in the game of losing weight. We are in the game of changing body composition, increasing skeletal muscle mass and decreasing percent body fat. I know every gym says that's what they're into too, but I can tell you, if you're not getting guided data to know exactly what your body needs and how to do it, just look back at how many months you've been going to that gym and doing the same thing, and it ain't moving for you. I'll tell you this, if you're in Ohio or you're willing to travel to Ohio and you want to do a VO2 max test, a graded exercise test to find out, first of all, a VO2 max test is your best predictor of mortality, all right? How well are you doing physiologically being alive? Not how good you can walk, not how good you are at marathoning, not how good you are at CrossFitting. I don't say that lightly. That's not what's going to predict your mortality. What your body's ability to take oxygen, deliver it to the muscles, and your muscles' ability to utilize that oxygen in performance, in muscular performance, in efficiency, creating energy, that is your mortality. It's not about your lungs. I had somebody very dear to me, my wife, who did her VO2 max test, and she got real mad because her lungs didn't give out. Her lungs weren't flaring, weren't burning when she maxed out doing her cycling test, okay? And it's because it's not a lung test. It is a tissue test. It's knowing the muscles that are being used, at what point are you done, based off of your heart rate, based off of your oxygen utilization with our test. Other types of testing devices, VO2 max or resting metabolic rate, they're also looking at a gas exchange between oxygen and CO2. Our test doesn't do that because head-to-head it's as very darn effective as the very expensive metabolic carts, except for it's a more pleasurable experience and being able to track, and we can modify the tests in the future for people too. So here's what I hope you remember, if nothing else, from this discussion. Zone 2 is not Zone 2 if you don't know your data. The best way to know your data is to get a graded exercise test, doing a VO2 max test, and being able to see data derive what your zones are, 1 through 5. If you're trying to increase your percent body fat utilization for energy, so using fat predominantly as energy and a little bit of carbohydrates, let's look at this again. Zone 2 is your best way to do that, okay? Let me just say this. Can you have poor nutrition, overconsumption of calories based off of what your metabolic needs are, and still get fat burn effectively and see your body composition change? The answer is probably going to be a hard no. You have to know all of these metrics if you're really going to dial in, or you can look back year over year over year that you did not have the success you wanted, you needed, you didn't feel better. And it's because you didn't have the data that you needed about you, not about anybody else. So Zone 2 for fat burning. When you're escaping out of Zone 2, you're increasing your carbohydrate utilization. Let's look at it again. All right, blue line carb, fat line utilization is the red line. So the harder you work out, the less fat you burn. Is that not about the opposite that most people, I'm going to say at least since the 1980s, before maybe the last 5 years, that this is what they were telling people to do? Work out harder, work out more, higher intensity. Now, real quickly, is high intensity interval training good for anything? Of course it is. Here's why I thought it was the winner chicken dinner back in the day. And part of that was because there was a study published by the Mayo Clinic around circa 2017, 2018 maybe, that was asking, is there such a thing as anti-aging exercise? And by definition, we know that as we age, our numbers of mitochondria diminish. So literally, our battery, our energy, all goes down if you do nothing to intercept it. You can eat clean, you can be healthy, you can maintain your weight, whatever you want to say, but if you're not intentional about actually raising the number of mitochondria, even with all those things I just listed, you're probably having a diminishing return on your mitochondria, okay, the actual numbers. Worse, if you're not actually straining them and giving them a stimulus, the quality of your mitochondria also diminish over time too. This is aging process, okay? This isn't hyperbole. There are studies that actually show this is what happens to mitochondria. This is also why we care about mitochondria, not just from metabolic health, but from a cancer ability and immune health perspective, okay? So without getting into those weeds. So Mayo published a study and said, yes, there is an exercise that's anti-aging. It actually drives the number of mitochondria up. What was that? High intensity interval training. I had patients go do HIIT, people who were struggling with fatigue, increased percent body fat. It didn't work. Why didn't it work? Well, for everything I just told you earlier, you can't you physiologically, this is where biochemistry and physiology comes hand in hand, you can't ask your body to do something that it's not made to do evolutionarily and get the result you want because you wish it to be there. This is where I talk about you can't do magic and have your body change. You got to follow the science. But this is where I'm going to say to you, if you don't have the data for yourself and you've been doing zone 2 to the best of your ability that you know, and your nutrition isn't dialed in, and I'm not picking on you, but I'm just being honest, your nutrition isn't dialed in potentially, or you don't actually know what your heart rate zones are, or you're not doing it as frequently, or the duration is long, those are things that are going to impact your zone 2 and how your body composition changes. So I'm Dr. Heather Bartlett. I'm a board certified family medicine doctor times 12 years. My passion is longevity. Longevity to me means not just fancy peptides, not just doing modalities that are passive. It means you are changing your cellular health, and we help you find out, if you work with us in our clinic, what are the fourth of the four horsemen, as Peter Attia calls them. So here's what I hope for you. This is the last thing I'm going to say about zone 2 cardio. If you go and you get on a treadmill, and there's a reason why I'm sitting on my erg and my bike, is because you know what those two things are that I don't do every day? Throughout my day, I am not on a bike all day, and I am not rowing all day. I walk all day. I stand all day. All right? If your body's not changing and you're doing this on a treadmill, or you're trying to do this exclusively through walking, all right, your body is so adapted to walking and standing, I'm not surprised if you don't see amazing results or results as fast as you want. A lot of people will do it, and you know what they'll do? They'll add a weighted vest. That's different. You're not wearing a weighted vest all day. That's a different demand on your body when you have a weighted vest on you, okay? So my tip to you is this. I would stay away from a treadmill. I would lean into a bike, a rowing, rotating between them if you're able to, or a ski erg, a different form of exercise that is different than just you walking if you're really trying to really get after it and change your body composition as fast as you can while using the data that you have about yourself that you've learned about from a VO2 max test. And again, if you're in Ohio and if you're in Columbus area, and you're trying to find a clinic that'll do a VO2 max test for you, we absolutely will do that for you. And it's part of our membership with our clients is built in. So happy zone 2 cardioing. Hope you learned something.